Healthcare experts are calling for an expansion of consultant pharmacists' clinical responsibility as a way to improve patient care and reduce drug-related complications in Nigeria. The demand was made at the 8th Scientific Conference and Annual General Meeting of the West African Postgraduate College of Pharmacists, Nigerian chapter, currently holding at the Pharmaceutical Council of Nigerian Auditorium in Yaba, Lagos. The conference theme, Expanding Consultant Pharmacists' Clinical Roles in Nigeria to Optimize Patient Care and Medication Safety, is focusing on strengthening specialist pharmacy practice in Nigeria. Our correspondent tells us more. The Pharmaceutical Council of Nigerian Auditorium in Yaba, Lagos is playing host to consultant pharmacists, healthcare professionals, academic policymakers and industry stakeholders attending the 8th Scientific Conference and Annual General Meeting of the West African Postgraduate College of Pharmacists, Nigerian chapter. The conference themed Expanding Consultant Pharmacists' Clinical Roles in Nigeria to Optimize Patient Care and Medication Safety is focusing on strengthening the role of consultant pharmacists within Nigerian healthcare delivery system. Addressing journalists, the leadership of the college said consultant pharmacists possesses advanced clinical expertise that can significantly improve patient outcomes through evidence-based medication management, therapeutic monitoring, and collaborative healthcare practices.
It's looking at the clinical roles of the consultant pharmacist to optimize patient care and medication safety. You can agree with me that the issue of medication safety is very, very important to the populace of Nigerians, because a lot of medication are taken and a lot of danger are inherent in it that the populace, the Nigerian, must know. We must know the importance of what we are taking as medicines. You don't self-medicate. You must have a prescription, and you must have a consultant pharmacist to explain to you what this does to your body, what your body does to the drug. So, because if you take the medicines are things that you take with prescription, it is not something that you just go out and take medication without instruction, without explaining to you. So the consultant pharmacists are there in the community. We refer to them as community pharmacists. The consultants are there. Those in the hospital, the clinical pharmacists, do a lot of this. So this is very, very apt at this time.
They stressed that expanding pharmacists' clinical responsibility would help reduce medication errors, improve the management of chronic diseases, and support safer use of medicines across hospitals and other healthcare facilities.
That look into this, and we celebrate all these days, drug abuse, substance abuse, by making sure that there's a lot of awareness to the population, especially youth. In our Ondo Ekiti zone, what they do is they go to the NYC camp and educate our youth on drug abuse and substance abuse. So I can mention some of our states that do this, because awareness is key. When you are very, very aware of something, you don't do it. So when you see somebody mixing up all sorts of concoction to take, that is not pharmacy practice. And a pharmacist, a registered pharmacist, will not go out of the way.
Stakeholders are also calling for stronger government support, improved policy interpretation, and increased investment in specialist pharmacy training to meet the country's growing healthcare needs.